Okay, in the last video we finished up working through the upper extremity. Now let's move on to the trunk musculature. This could be a whole video series unto itself. In fact, there's lots of video series devoted to the core and the trunk musculature. What I want to do is just highlight, again, just like with these other patterns, some of the, these kind of subcategories that fall inside the trunk, and then some general training principles for them. All right, so let's get right into it. Flexion, okay, extension, all right, rotation, okay, controlling those movements. So anti-rotation, so resisting a rotation. Anti-flexion, so resisting that, okay. Anti-extension, resisting going to extension. All right, so a lot of times when we think about the trunk musculature, we focus on the concentric activity. So I'm gonna do some crunches on the floor, right? I'm even gonna do some lateral choppers, right? So I'll get the band, maybe, I get in some position, right? And I'll do some chopping, okay? I could do a half kneeling. So, if this was a higher band position, right, and I chop down, okay, we get the opposite leg here. So I chop down, okay, I could even chop, but that's great, that's good concentric movement. But the trunk musculature, many times, and the way we want to utilize it, most of the time the concentric stuff comes from, if I do a lot of these, I can see my abdominal muscles, rectus abdominis, right? We know that that is dietary related. That is not necessarily more trunk musculature related. So this, unfortunately, spot reducing is it's not untrue, but it's more myth than it is true, at least more than we'd like. When it comes to the trunk, though, what we're really concerned with is stability and, again, anti-movement, all right? So I can do the same chopper if I put this up a little bit higher, but now instead of focusing on just the concentric movement, okay, now I'm working on controlling all the way through, all right? Keep my knee outside my big toe. Again, I'm controlling this movement rather than just banging out a whole bunch of reps, okay? And so when we're being thoughtful of our trunk training, we should be thinking about these different regions of the trunk, flexion-initiated muscles, rotation-initiated muscle, and extension muscles in the context of anti-extension and stability. All right, so let's explore a few of the exercises. Again, this is a long list of potential exercises associated with these different muscles associated with the trunk, but let's hit some highlights. So let's start with the flexion musculature, okay? Again, your traditional crunches are fine, but remember, those are concentric dominant. And when we talk about sit-ups versus crunches, again, if we're doing our back saver one or our Stuart McGill one, right, we have one leg extended, okay? But a crunch here, this is it versus a full sit-up. When we sit up, we tend to incorporate more hip flexors, okay? So doing crunches, opening up the abdominal wall, okay? Squeezing it down, all right? Now, if somebody is in more of an anterior tilt, you can execute a lower abdominal type of crunch. Again, making sure control here is the most important thing and not just rolling the hips erratically, okay? So neutral spine, hey, I can use my hands to help roll me up. I'm gonna keep my heels close to my butt. That'll keep some of the stress off my spine, and I can focus on the lower abdominal area, okay? You can't necessarily preferentially just recruit the lower abdominal area, but you can have more recruitment in that area. I guess preferentially is the right word, but you can't just isolate the lower abdominal area. You can have more preferential recruitment, okay? So as I come up, I'm gonna roll up nice and slow, and roll my hips up off the ground, and then back down, okay? So this could be something that's handy for somebody who has anterior pelvic tilt, but it'd probably be bad for somebody that's sitting in a desk all day. So you can work both ends of the rectus abdominis, the anterior wall, by a crunch and some sort of hip roll up, okay? Just make sure that you're not increasing more stress on the spine by the body position. All right, so that's flexion. Now, anti-flexion comes through controlling those movements on the way down. You can also do things like med ball slams, okay? They're very common to do some sort of pull the ball up, right? Okay, and slam the ball down. Now, what's typically done incorrectly with those is there's a lot of trunk flexion, okay? Instead of coming up quick with the ball, okay, there's some rapid flexion, rapid extension occurring, and so that's gonna really challenge the anterior wall. And so as I come up, I'm trying to control extension, not to let it go into hyperextension. I'm gonna really see a lot of stress placed on the anterior wall, and then as I come down, I'm using my hips to slam the ball, okay? So another abdominal flexion-related exercise, and of course, one of the most common that really create a lot of eccentric stress on that anterior wall is the ab roller. So using the little wheel, okay? As you use the ab roller, just make sure you shove your hips into the wheel as you roll out, okay? And then as you roll back. So you wanna leave your hips back. So if I had the roller here, again, I wanna push my hips into the wheel all the way out into full extension, okay? Again, that's an eccentric load on that anterior wall, That's a fantastic exercise for that region. Rotational exercises. So I already showed you some of the chopper variants. You can, of course, do reach across crunches, and there's a lot of the L crunches. There's a lot of different crunches that we can do. Okay, there's the standing versions of these choppers. There's a lateral chopper here, right? I can have a pronated grip or a supinated grip. Okay, and I'm just rotating and then controlling on the way back, right? Rotating, controlling the way back. You could have a single handle here if it's a cable pulley. It's a little bit harder to do with the band, but so you can see it, right? Okay, so more of a traditional crush grip. Okay, and then you can do half kneeling as well. Again, for those of you that have been training people for a long time, these are nothing new. What we're trying to do is, you want to make sure the inside leg is up, is you want to isolate that musculature as much as possible. So what I'm going to do is create this half kneeling position so I can't use my hips. So I can only use the muscles of my trunk, okay, into this rotation. Now, you can do mixed grip like I did. You can just saw and then push. But all these movements are designed to increase the stability of the trunk musculature and not necessarily emphasize the concentric movement. All right? So if I'm going in this position, staying nice and tall, I have to maintain control, okay, of that trunk, or I'm going to lose it. All right? So that's anti-movement related as well, not just concentric. Again, I could have a low chopper position, okay, and now I'm going to chop up. So the band will be here, and I'm going to chop up and then kick it away, or start here and kick it away, or stay long all the way through and chop up. Okay, either version, right, is going to create, again, anti-movement. I'm trying to control the trunk while I'm moving, right? There's some sort of trunk perturbation coming from my limbs. My limbs are moving around. That's how the body works. We'll talk about planks in a second, but internal to external, okay? You have to maintain stability, all right? What about the erector group? Again, we're going through these, just kind of doing a 30,000 foot view of these, okay? The erector group, bird dog variants, of course, very, very handy, all right? Making sure our spine is neutral, avoiding any sag back, right? Lordosis, hands and knees on the same level, hands under the shoulders, knees underneath the hips, okay? Neutral spine, and then I'm just gonna reach out and then come back, reach out and come back. If somebody needs to start with just their arms, they can. Of course, from here, you can start to hold dumbbells if needed. You can start to do different variants like waving, okay? So I can come here, and then I could wave, and then come back. And those are different ways to increase the intensity of the exercise. Again, layers in their progression, all right? Since I'm down here, let's also talk about planking. A wonderful exercise if progressed. Otherwise, it doesn't really fit how the spine works. So what I mean by that is if you're down into a plank and you're just holding planks for long periods of time, that's wonderful. But remember, the body doesn't just stay in a position like this all the time. There's always movement going on, okay? So the progression, the natural progression of a prone plank, okay, I can start to move limbs. Okay, I can start to move my arms. Okay, I could have a band tied up here and do band pulls. The same with, now if we're getting to our rotational muscles again in our side planks, and the different variants, whether it's a straight leg, foot across, or the knee bent for a little bit easier, all right? Usually on the elbow underneath the shoulder, okay, same thing. I can just hold, but then I can start doing reach throughs. I could have a band and pull, okay? I could have leg lifts out of it, okay? There's a progression to challenging the trunk musculature. The last set of exercises related to the trunk, and we could spend a whole series on this, is reverse hyper type of exercises. Now, there's reverse hyper machines, and then there's this kind of category that would kind of fall into leg swing slash what I'll call reverse hyper, okay? So off of a bench or blocks, whatever it may be, hips off the bench, and this is gonna be for our erectors, okay? So I can do a tuck, all right? So make sure my hips are off the bench a little more. Tuck. I could do a march. Okay. I could do a flutter kick. I could do jumping jacks. Right. I could do halfway down, all the way up. And there's a lot of different varieties to challenge that lower back musculature. So you could just do a straight hold to start, and then start to move the legs in different patterns. I've used bands in the past and pulled on, when the feet were straight, tied a band around somebody, and then pulled on them randomly. Just obviously not the first day that you do this, but that could be a more advanced technique. There's a progression to all these trunk exercises. So just make sure that you're observing those as you're going through them, okay? Don't stop at just long hold times for the basic position. Add in limb perturbation, okay? Add in that limb perturbation. It'll really challenge the trunk to control movement and not just generate movement. And that's what we're really after with the trunk musculature. All right, that's it for trunk. Again, we could explore this deeper, but let's stop right there, and I'll see you in the next video.